I want you to think about your neighborhood. Pick a place you go regularly, your workplace, or maybe the grocery store. How do you get there? If you wanted to walk or bike there, could you? Now, a lot of you are probably thinking, well, that's just not possible. If that's you, then what is standing in your way? Think critically about the route you would take. Maybe your destination is simply too far away. It would take too long. Or maybe your route looks something like this: a busy road with multiple lanes, narrow sidewalks, no safe crossings, no shade, and frankly, little beauty. As Mitchell Jorsted tweeted so effectively, this outside that has been built over decades is a huge barrier to the proverbial going outside, playing and being active in our communities. This, combined with a food system that prioritizes cheap, fast, abundant calories over nutrition, has dire consequences for our health. By 2030, it has been projected that almost half of all US adults will have obesity. And obesity increases the risk of some of the top killers in the US: heart disease, cancer, stroke, chronic lower respiratory disease, diabetes, and yes, even COVID-19. But the implications of the way we've built our environment do not stop with population health. They extend to the health of the planet. Our recent Lancet Commission on Obesity identified transportation, land use, community design, and agricultural systems as the 4 common drivers of both obesity and climate change. They call for comprehensive actions that explicitly address both obesity and climate change as 2 intertwined pandemics that represent the paramount health challenge for humans, the environment, and our planet in the 21st century. Urban, rural, and regional planners have an opportunity to disrupt these common drivers at the local level, and in doing so, to create places where it's easy to be physically active, eat healthy, and promote planetary health. That's why my research is looking at one of the most essential tools that American planners already use to develop their cities, towns, and regions: the comprehensive plan. Comprehensive plans guide the built, social, and economic development of a community. They provide a vision developed by the community for what it wants to look like in the next 10, 20, or 30 years. This is a time for the community to dream up a new future, something that's really important when we're thinking about big systemic changes. They contain a blueprint of specific policies, strategies, and projects for then making that vision happen. Writing a comprehensive plan is a process that has education, engagement, and consensus building components. In Wisconsin and 33 other states, other planning policies like the zoning code has to be consistent with an officially adopted comprehensive plan, giving the plan legal standing. And what I think is most important, comprehensive plans are holistic. They cut across departments and sectors that would otherwise work pretty independently. And this is really important because big problems like obesity and climate change require cross-sector collaboration and alignment. So I'm exploring how much healthy eating and active living show up in comprehensive plans, if this can lead to better health outcomes, and how local planners can begin to move the state of the practice forward. Now think back to our first thought exercise. Remember when I asked if you could walk or bike to work or the grocery store? Some of you may have thought, well, hold on a second, Lisa. I actually can walk or bike there. That's great. Maybe your route looks something like this or like this. For some of you, walking or biking might not just be possible, it might be the most convenient, the most fun, and the most beautiful option. If that's so, I'm willing to bet you right now that if you dig up your community's comprehensive plan, active transportation like walking and biking will feature prominently. It's my hope that through more plans like that make it their objective to build places where it's easy to be active and eat healthy, we can make local level changes that have big payoffs for planetary health. Thank you.